group kind of had an aha. John was kind of outlining the whole process related to our specific question. And it occurred to us that the model had multiple levels of implementation. In other words, it could be looked at from a global perspective, from a state perspective. I mean, from a nation's perspective, from a state perspective to your local area, and that if you look at it under different lenses like that, you're likely to see different things in each one of those four boxes across the middle.
I floated, so this actually is from listening in on two groups. First of all, we have to keep in mind that we're talking about a wide range of health professions. And so there's different financing mechanisms and very different levels of community engagement for those professions. So as we carry out this work, to keep that in mind. And then similarly with financing, it's multifaceted. And I won't go over what the facets are. We talked about it in one of the groups. But it's coming from multiple directions. So neither of these is something that is just sort of a nice, big, comfortable category. They're both quite complex.
And while there's variation in engagement with the community, there's also variation in engagement with the public sector.
Yes.
Across.
Yes, exactly.
Just one comment on the audience question that was asked, and our group really felt that the model could be used for any of the actors that we described early in the day, so that for any one of those actors, you could focus and emphasize different aspects of that model, which I thought was an interesting reflection. And one other reflection from myself, and bringing us back to what Edson had brought earlier, he mentioned the information gap. And as I'm just reflecting on what we've heard today, we know that public funding is limited globally. I mean, it doesn't matter which country you pick, public funding is limited. So therefore, we're going to look beyond public funding to private, public-private, which is likely to be demand-driven. And demand is going to be driven by perceived need. Yet perceived need, the link between perceived need and actual need, that's where the information gap plays a role. And I think in this room, the health professions educators can play a role in bridging that information gap to better align real need with perceived need and drive the system that way. Can we drive demand based on real need? And that information gap could be on the services that are demanded or on the cadres that are demanded for that service you provide. So I think if we can come back to tomorrow, I don't know when, but the idea of the information gap and that potentially being a strong lever we can play in health professions education.
I think, Ray, you're starting the discussion about what we do after the workshop.
Perhaps.
Other thoughts at the end of the day?
Our group got into that slightly different. We talked about if the employer drove health professions education based on need, then that might actually be a disconnect to sort of the global need and being futuristic, because we know that we have waves and what we need. And, to be cautious about when we're talking about who's financing health professions, that we are equal in our approach.
Anything else? Yes, Patricia.
In the latter part of our group, we really talked about trying to identify cost. And I think when we talk about financing, we can't continue to talk about financing until we really talk about what does it cost. And
Specifically and in detail.
In detail. And so what I'd like to do is just recommend to people to look into activity-based costing. When I had a grant with the New York State Insurance Company many years ago to cost out school-based health centers, they were trying to determine whether they were going to fund those. And we used activity-based costing as a model. And it is a very kind of clean model, if you will, that could be used across settings that would allow us to do some kind of comparison of all different kinds of ways of implementing But we keep talking about financing and not really accepting the responsibility to figure out the cost.
Very good point. Any other comments? Great. This has been a great day. I don't know about you, but my brain is really tired. And the planning group will meet in 103 behind here, so that we can labor through the night and adjust the model. Tomorrow morning, 8 o'clock here. What we're going to do tomorrow is we want you to think about the model and where we're going, really, and we'll talk about the other lessons from the breakout group. We'll talk about, Malcolm is going to give us a disquisition on models, and he'll talk for hours on models, I think. But really, coming back to the group and say, all right, how should we elaborate it further? What have we learned today? And then where do we go further, both with the model and with the work of the forum in this area? So thank you all very much for your time, attention, and really wonderful insights.